Frontiers Health 2025 with Rob Milnes, the Senior Vice President of Women's Health and Longevity at Ultrahuman. You just got off the stage in a panel talking about M&A in digital health, right?
That's correct, yeah.
So tell me about what brings you insight into that in terms of your work with Ultrahuman.
Yeah, so we've just sold my company to Ultrahuman back in August of this year. We are a women's health business, women's digital health business, clinically proven, and we've taken our algorithms, essentially imported them into Ultrahuman's wearable devices.
So what were some of the biggest takeaways you had from that experience that you shared with the Frontiers Health crowd?
Well, the first thing is that you have to find a party that's really interested in talking to you for a long period of time to get a sale over the line. So, you know, you have to engage with a party that's really going to understand your value proposition and move from that value proposition to producing something that's a new future for both companies. So that's really, really important, I think.
Yeah, I think so many startups just worry about the exit and getting the exit, but that's just the beginning, right? You've got to learn to work together and you've got to actually deliver value as a combined company.
Yeah, absolutely. I couldn't agree more, and I did say that, exactly that on stage, which is, you know, people ask if your exit has been successful, right? And people often announce it on the day of the exit itself. Well, that is the beginning, not the end, right? And I think seeing it that way from the start is really important. Why did we exit? We wanted to reach 100 times more users with our unique technology. And the only way to do that was through merging with another company.
Anything else that you learned in that conversation on stage? You were up there with Jeff Dachis.
Yeah. I mean, Mark asked us at the end about consolidation and where we see the future of consolidation. And I think Jeff was less positive about consolidation in the industry than I was. I think he thinks that because healthcare is so siloed, that it's quite difficult to bring different operators together, even around the same subject area. So his subject area is diabetes, mine is women's health. I think we have a slightly stronger ability to port digital algorithms into women's health based devices, so wearable devices in particular, because there's this need to be moving in a direction of clinical evidence on wearable devices. Otherwise, clinicians will not use the data that's being produced by them.
Well, I think that's probably all we have time for, but thank you so much for chatting with me.
Pleasure. Thanks very much.